my name is Amy. I am a nurse in the emergency department, and I wanted to hop on and tell you a little bit about how I got here and what a day in the life of a nurse is. So from a young age, I knew I wanted to be in healthcare. I wasn't really sure where I wanted to be in healthcare, but I knew I wanted to help somebody. I feel like that is something that you're born with. You have that trait to want to help somebody. And when you know you want to do something in healthcare, you just know. There's no other way to explain it. So at 16, I got my EMT. I had followed the advice from a couple of family members who were in healthcare, and they said, get the experience when you can. And it was the best advice they could have given me. So I got my EMT at 16 and began volunteering on the local rescue squad, where it gave me a lot of the critical skills that you need to be a nurse. You need to be able to think on your feet. You need to have critical thinking. You need to be compassionate and understanding that it's not always going to have a good outcome, but when you do have a good outcome, it's an amazing feeling. So from there, I graduated high school and I attended Gwynedd Mercy University, where I got my nursing degree. And I got my first job at St. Mary's Medical Center in their step-down ICU. And from there, I knew that I still needed a little bit more, so I moved on to the emergency room, whereas my current job is now as an ER nurse. The day of the life of an ER nurse is very unpredictable, can be very tiresome, but it can also have a lot of benefits. You see people at their worst and see people for their worst days. And at the same time, you could be celebrating the birth of a new baby or telling somebody that their scans look better than they did when they got seen by the doctor last. And it's very important to recognize the two things that you'll be doing in nursing, and that's caring and working as a team player. It's really big to be able to work in a team of people, because that team of people has really carried me through some of the hardest days of my career and been there to celebrate the best days of my career. We can see anything that walks in that door, from a broken bone to a cardiac arrest, which is when your heart's stopping, to abdominal pain, to a splinter, to an old grandma who just needs somebody to talk to, and now currently to COVID-19 patients. You don't know what you're signing up for, but what you do know is that you're signing up to take care of people. And when you get to take care of somebody, it is the best feeling that is unexplainable. And I hope that if you do have a thought of becoming a nurse, you follow your dream, because when you walk that stage and recognize that you're going to be able to take care of people, it's a very empowering feeling. I hope that you follow your dreams in whichever way that leads you. And if you have any more questions for a nurse, I'm here to talk whenever. All right, I'll talk to you soon. Bye. Stay safe, everyone, and stay inside.
Hey everyone, my name is Krista. So my job is the lead athletic trainer. I actually work in the office. I don't work at a school anymore because I'm leading. My day-to-day is a lot of scheduling and working out conflicts and other things required by our governing bodies, like the Joint Commission and different activities. But since the coronavirus thing is going on, this is what my day-to-day looks like. I have to scan temperatures a lot and also do a lot of scheduling and other things that I don't typically do, but I'm doing now because we're all stepping up and trying to do everything that we can to continue working and follow guidelines and all of that. And the path I took to get to the lead athletic trainer job, went to college at Alvernia, for athletic training, took my boards, passed, worked at some other schools, worked at Penn State Berks, and then I worked at a really big high school in York County called Central York, and that led me here. So hope you guys are good, stay safe, wash your hands. See ya.
Hi, my name is Michelle Capps. I'm a certified veterinary technician at Penn Vet. I've been employed with Penn since 2011. My role is a surgical nursing staff supervisor. I've been a veterinary technician since I graduated high school back in 2005. College requirements for becoming a veterinary technician would be attending a 2-year college majoring in veterinary technology to obtain your associate's degree in applied science. Upon graduation, you'd be eligible to sit for the Veterinary Technician National Examination, and in which you would become a certified veterinary technician, and you will be compensated more so than a non-certified veterinary technician. My recommendation, if you have a strong interest in perhaps working in the veterinary field, strong passion for pets, it would be wise for you to try to volunteer at a local animal shelter. You'll get your feet wet, you'll see if this is something that you're truly interested in, and then you can go from there, whether you want to pursue it as a career or not. If you have any further questions, I'd be happy for you to reach out to me. I wish you much luck. Thank you.
Hi everyone, my name is Brittany and I've been a physical therapist for about 5 years. I graduated in 2015 from Drexel University with a doctorate in physical therapy. It took about 4 years of undergrad as well as 2.5 years of grad school to obtain my doctorate. While I was an undergrad, I worked as a physical therapy aide in 2 separate outpatient clinics, and I had the unique opportunity to observe at a rehab hospital down the street from school. At that rehab hospital, I was exposed to different areas of physical therapy that I didn't even know existed, which kind of opened up my eyes to kind of delve further into all the different avenues. At grad school, I was able to have 4 different clinical internships. I worked in home care, in an outpatient orthopedic setting, in an outpatient neurologic setting, and I also worked in a rehab hospital. Through these clinical internships, I was able to get a better idea of what a day-to-day life looked like in these treating therapist settings. And eventually I chose to go into acute rehab, which is where I work now. So right now I see about 6 patients a day from 45 minutes to an hour and a half each, depending upon what those patients' needs are. I see patients with a variety of diagnoses, including patients after stroke or brain injury, spinal cord injury, patients who have been in a motor vehicle accident, patients who have elective surgery like a knee replacement or hip replacement, and those are just to name a few. What all these patients have in common, although their diagnoses may vary, is that they are lacking some sort of independence with their mobility. So I teach people how to go from sitting to standing, how to transfer from a bed to a wheelchair if they need. I work on people just being able to sit on the edge of the bed so that they can, get washed or dressed. I teach people how to walk again, how to climb the stairs. I teach people how to alter the ways of doing things if they can't do it like you or I would. I teach people how to independently move around their homes or in their communities. I love my job. I love getting to see people going from not being able to care for themselves or do things for themselves into regaining some sort of sense of independence, even if they can't completely do everything on their own. They can do things that they never thought they could when they got to us. If I could give you guys any piece of advice if you're looking to go into the field of physical therapy, is get out there and start observing as much as you can and in as many different settings as you can. I know physical therapy, when you think of physical therapy, a lot of times you just think of outpatient, but there's so much beyond that world, and it kind of just opens up your eyes to all different sorts of possibilities. If you have any questions at all, feel free to let your instructor know and she can pass them on to me, and I would love to hear from you and love to answer any questions that you guys may have. All right, thanks. Bye.
Hello, everyone. My name is Lister Austin. I am an emergency medical technician in Bucks County. I have been doing this for 27 years. When I first started doing this job, I was a volunteer. I used to walk past the rescue squad, and all I wanted to do was just turn on the lights and sirens and drive, but that's changed. Why did I do this career? This is humanitarian work. Saving lives is a calling, just like being a police officer, a firefighter, or soldier. So this is what I do to give back to my community, and it's very rewarding in certain ways. We walk across all types of life. We deal with all types of emergencies. You think of it, I've seen it, been a part of it. There's not very much that we don't come across in this industry. Why did I choose this path? Again, the lights and sirens. What could you do to possibly become a part of this? Most of your tech schools have the EMT program in Bucks County. You can start off and become a volunteer at the age of 16 at any of your local rescue squads. If you have any questions, you can, forward them to whomever your instructor is, and they can get to me. That's pretty much it. I do 911 work. You call, I show up. As you can see, it's the back of an ambulance. I hope that no one ever has to come back here. Enjoy your day. Take care. Stay safe.